to Thursday. General matters. In this, we invite many guests, many experts from many fields.
Ukijiwekea mambo, unaweza kuwa na msongo wa mawazo.
Health and related matters, medics, physicians and related professions, youth matters and counseling matters.
Vile tunavyolea watoto ndivyo watakavyokuwa.
Dear viewers, you cannot miss NASAHA kwa UMMA show every Monday to Thursday from 12 noon to 1 p.m. Keep watching NASAHA kwa UMMA, keep watching Al Huda TV. To NASAHA kwa UMMA show. With you is your host, Dr. Sheikh Lawyer Hassan Kinyua Omar, and today we are honored to have two great personalities in matters medic, and I have with me two experts. The first one is our guest today, Mr. Hans Tinebag. Thank you so much, Mr. Hans Tinebag. Is from European Endometriosis League, and he's joined by Dr. Ezekiel Mecha.
Good afternoon, viewers.
Good afternoon. Dr. Ezekiel comes from the same university which Dr. Hassan Kinyua Omar comes from, and that's none other but the University of Nairobi, from the Department of Biochemistry. So he actually knows Professor Abdul Ghaffur Al-Busaidi in a very well manner. Dear viewers, what we'll do, as it has been our custom, first today we are discussing very important topic, endometriosis. I'm not an expert in this, of course, so it is our guest who will be telling us what is this. But before we do that, it's important we listen to them a little bit to understand the background a little bit. So I think we can start with you, Brother Hans. Your background, please.
Well, good afternoon, ladies and gentlemen. It's a great pleasure and honor for me to be here. It is my first visit to Kenya, and I am overwhelmed by the reception that I received. I am an emeritus professor of obstetrics, gynecology and reproductive medicine, and I have been working in the field of the disease that you just mentioned. Yes. The name is endometriosis, hard to understand and to remember, for more than 40 years, so it's a very long time. And I have founded the European Endometriosis League, and I'm now the honorary president of this. And as a university teacher of the University of Gießen, close to Frankfurt in Germany, I was happy to have Dr. Ezekiel Mecha, which is sitting next to me here, as a PhD student. And I'm even happier to see that he is very successfully carrying on what he was doing in Germany with me, and that is that he is researching the disease endometriosis in order to find an early diagnosis of this disease so that people do not have to subject themselves to a surgery.
Thank you. Thank you so much, Professor Hans Tinebag. Now let us know who is Dr. Ezekiel Mecha.
Thank you very much. My name is Dr. Ezekiel Mecha. I'm a lecturer at the Department of Biochemistry, University of Nairobi. Also, I'm an endometriosis researcher. I've done endometriosis research for the last 10 years, and currently in the front line of creating endometriosis awareness, and I'm also involved in bringing together stakeholders in endometriosis management. So Professor Hans Rudolf Tinebag was my PhD mentor, And right now we are cooperating. At the same time, we have a number of students from Kenya who are in ISLAP in the University of Gießen, and what they are doing, they are trying to find an early diagnostic markers for endometriosis. Thank you very much.
Thank you so much, Daktari, and we are happy that you are doing this as we will be witnessing the establishment of University Alumni Foundation tomorrow at the University of Nairobi. The event actually, which we believe maybe we'll be covering it live, maybe if things go as we have planned. Now, let us come to the viewers, because you know you are just talking about endometriosis. In fact, when our guest Hans Attenberg read the word, he just said endometriosis. Now, the viewers are wondering, what is this endometriosis? It's something maybe they have witnessed, something they know, but they are wondering, what is this? So, what is endometriosis?
I'm happy to explain what this all is.
Yeah.
We all know that women are the backbone of our society. They are the ones that keep families together.
Yes.
And they are the ones that have to be present from early morning to evening. But they are also the ones that only they can experience this disease. It is exclusive to women. Yes. We also know that women in their reproductive age have nearly every 4 weeks have a menstrual period, a bleeding. And apparently in most cases where the disease endometriosis can be detected, this menstrual period, this menstrual bleeding can be regarded as responsible for the onset of this disease, because not always the blood leaves the uterus through the vagina, but there's also some blood that might sort of be pumped into the abdominal cavity, into the abdomen, through the open tubes. And when this blood gets there, and I'm sure Dr. Mecha will support this, there are cells in this blood that can implant. It is like putting a seed into a fertile soil, and then it will grow. And as the roots of a seed migrate deeper into the soil, also these cells dig deeper into the peritoneum, the inner lining of the abdomen. I hope you pardon me for giving this example, but I just want to make it plausible for everyone to understand what endometriosis is. Now, when this happens, when this is implanting, when this is digging into the surrounding tissue, this will create pain, this will create inflammation, and that inflammation then enhances pain and also infertility. So quite a number of women that have an more or less unexplained infertility, they cannot become sick, they experience endometriosis, and therefore endometriosis has to be removed for them to become pregnant easier.
Okay. Now, number one, Professor Hans says that he is sure that you will support his explanation.
Yes.
Which I believe in research, sometimes you have to confirm after undertaking research. So this is what you'll explain to us. But what I'm hearing from him also is that doctors have to remove endometriosis so that the lady tissue, so that the lady can become fertile. Kindly explain to us how that is done. And even before reaching there, it might be of importance if you tell us what are some of the symptoms which a lady can have and know that now this is endometriosis. Because as you know, in our cultures, things to do with sex are taboo to discuss sometimes. So a lady might be suffering, but she doesn't even tell even the husband. So please tell us first, what are some of the symptoms which can lead a lady to know that this is what I'm suffering from, or you tell us how it can be detected, and then you tell us when you say that it has to be extracted, how is it done?
Thank you very much, Dr. Ali. So I'm going to explain in similar terms, and maybe before I discuss what you have said, maybe I can add what Prof said about these cells. So when these cells moves from the uterus, that's the womb, to wherever they were and attach, the way I said, every month when a woman menstruates, the cells, wherever they are, they also respond to the response to the hormones. Mm-hmm. So wherever they are, so if these cells, for example, they are in the lungs, we are going to have bleeding in the lungs. If these cells are in the eyes, we are going to have bleeding in the eyes, etc. So that's what I wanted to add on what he said. Then the problem of endometriosis is that the symptoms or signs of endometriosis, they are similar to many other gynecological diseases or conditions. Mm. Yeah, so that's why it takes a long time for this for endometriosis to be diagnosed. Yeah, you have heard people talking about painful periods. Yeah, so some people are taking painful periods as normal. Yeah, but in most cases, if the pain is much, and if that pain happens every 4 weeks, then that's a sign of endometriosis. So apart from that, the other symptoms of endometriosis includes severe or painful sexual intercourse. Yeah, as you have said, matters of sex is a taboo to most of our communities or most of our in the African setup. But and most people they always feel ashamed. Mm-hmm. Yeah, or they feel shy to talk about painful sex, etc. So if sex, which is supposed to be enjoyable, in quotes, if it's painful, then that's a signal that this might be as another sign of endometriosis. Then also the other sign of endometriosis, apart from painful sex, then we have painful periods. Then there's what is known as dyspareunia or increased frequency of urination. Yeah, so those are the main signs. Maybe I can ask Prof to add other symptoms.
Well, first of all, I'm very grateful to you, as you said, a lay person in this respect, to mention the topic, as you also explained, that there are taboos in society. Yes. This is not only in African society. I think this is in most society. Yes. It is unusual to talk about sex-related aspects. That's true. That's why these women suffering from endometriosis are excluded somehow from society, because they cannot explain what's going on with them, because it is regarded as being a dodgy subject, something that you don't talk about. And there are things like, you mentioned some of the extreme ones, but for instance, if a woman has every 4 weeks an infection of her bladder, the symptoms of the infection of her bladder, she will be treated according to this infection, this bladder infection. Yes. But if this happens every 4 weeks, then she is more likely to have endometriosis, and being treated with antibiotics is even harming her than helping her. Because, you know, we create resistance to this antibiotic, yes, and it ruins the other bacteria in our being. When a woman experiences pain whenever she has intercourse, because there is endometriosis at the end of the vagina, and whenever it is being touched like this, she is in pain, yes, then if the relationship to her husband, to her lover, whatever, splits up, then she's being made responsible, but it is the disease that causes it. Mm-hmm. No one will understand that every 4 weeks this woman has stomach pain, has abdominal pain, has pain during intercourse. Mm-hmm. And if it persists for some time, it is very chronic, and it will not only be every 4 weeks, but it will have an extended period. Okay. So This is a medical problem, but it is also a problem of society. Okay. And I must tell you, the second East African Society of Endometriosis conference that was organized by Dr. Mecha here in Nairobi and supported by University of Nairobi had a pre-congress workshop where I performed surgery on women with endometriosis. And there was one woman with a massive endometriosis of the bladder, just explaining the symptoms that I just mentioned, and another one that had a big tumor in the bowel, in the rectum. So she was unable to properly pass her feces to have her bowel movements, which is a daily problem then for her.
That must be a lot of pain.
Yes, it causes a lot of pain and dysfunction.
Okay. Now, there are many women we hear speaking about cramps.
Yes.
They'll tell you that I'm not at work today, I'm not in good mood, don't even talk to me because I'm in cramps. Is cramp in any way associated with endometriosis?
Yeah, maybe I can answer that one.
Yes.
I think we have already alluded to that. If you have severe pain, yeah, and maybe you compare yourself with your workmates, your college mates, etc. If you are pain, those cramps are very, very severe, then you need to see your doctor. Okay. You need to see a physician. So that's why we say you don't normalize pain during periods. Yes, so you need to see a physician as early as possible. So also we talked about the similarity of endometriosis with other conditions. And that's why the diagnosis takes a long time, because people say that, my periods are normal. So in most cases, the average diagnostic period takes between 6 to 11 years. Yeah, so you can imagine if somebody has been having pains from maybe, let's say, her first period at the age of 13, then you add 11 years, 10 years, the age of 23. So you can imagine if such a person is having endometriosis, what havoc it is showing, or what havoc or what effect has this condition caused in the body. So that's why you find most women, they normalize, and at the end of the day you find that they are infertile. They become infertile without knowing. They don't get babies, etc. Then there's a question you asked, maybe I can answer it, about diagnosis. We have a world standard for diagnosis, which is known as laparoscopy. And I can say here that the first person, the person who was among the first group to do laparoscopy in the world is none than my mentor, Hans Ruth of Tinnepak.
Congratulations.
Yeah, so they did the first surgery in the University of Kiel, which is in Germany. That was around 1980. Then after they did the first surgical operation, they were invited to USA, and they did a number of trainings. I think there were how many trainings? Many trainings, around 70-something trainings, 76 to be specific. Yeah, to train about laparoscopy. But now the problem is laparoscopy is very, very expensive. Yeah, so a procedure in Kenya, it costs more than Kenya shillings 300,000. Yeah, which is very, very expensive. Yes. Yeah, so what we are doing as scientists, what we are doing locally, and also have a number of students who are in Professor Hans Tinnerpak's lab in Gießen, Germany. What we are trying to do, we are trying to come up with an early, we are doing experiments, we are doing research, and the main aim or the main objective is to come with a marker, or to come with something, a protein, or something which can be used for early diagnosis. So what it means, when a lady starts menstruating and we find a certain molecule we find a certain particle in her menses, for example. Yeah, that's an example. Or we find this particle is in our blood, or we find that molecule is in our vaginal secretion. The way you see, like in cancer, we have a cancer screening using the swab. So we are trying to see if we can get such a molecule so that instead of a woman who's suspected to have endometriosis, instead of them going for surgery, because that's the standard procedure, and for somebody to go surgery, the person should have undergone, maybe should have suffered from that condition for a long period without knowing. So we are trying to come up with markers or molecules which can be used so that when a lady starts menstruating and this molecule is in blood or this molecule is in vaginal swabs, yeah, we can say this lady, she's developing this condition, or she has a tendency of developing this condition.
Okay.
Thank you.
Another question which comes is, as you well know, there are things which trigger some diseases and some medical conditions. So for endometriosis, are there behaviors or characters or lifestyle which can trigger?
I think this is more a clinical question.
Yes.
And I have to compliment you.
Thank you.
You ask very good questions and also giving a good background to it.
Thank you.
There is, when you look at the history of patients with endometriosis,
yes,
there is a hereditary factor, which means that if mothers have endometriosis,
yes,
there is a great likelihood that also their daughters will have endometriosis. We know from studies with siblings that if one sibling has endometriosis, most likely the other one has endometriosis too. So there is a genetic factor. It seems that also there are other genetic factors. Since I come from Germany, particularly from northern Germany, it is said that women with red hair are more likely to develop endometriosis. But what we know is, if a woman has very often menstrual periods, then this increases the likelihood of endometriosis. If a woman has given birth early in her life and quite frequently, which I have seen being the case in Saudi Arabia, where I have been lecturing a lot.
okay,
So it reduces the likelihood. But of course, nowadays society does not want to have many children. Women or families are happy with 2 children.
yes,
And if there are many menstruations in between, then the likelihood of developing is high. So therefore, a continuous oral contraceptive is one way of reducing the likelihood of having endometriosis. The other thing is, there are also some anatomical factors. When talking about Mashinani laparoscopy in Tumutumu Hospital,
yes,
we saw a woman and we operated on her that had a blockage of one uterus. She had 2 uteri, and one uterus was constantly menstruating to the abdominal cavity. So that's why she had this endometriosis.
yes,
But also some forms of surgery can also cause endometriosis, as is, for instance, cesarean section. You know, if a C-section is being performed, sometimes the material of the inner lining of the uterus can be transported into the wound, but also, since blood vessels are open, this can also go to other organs, as we discussed, the lung, the brain, the ear, whatever.
yes. Now, let us come to the issue of prevention. We know very well that sometimes, for example, when you come to cancer, you are told that there are some lifestyles which, if you adopt them, you at least decrease the risk of being cancerous. And also, when now you are already diagnosed with cancer, then in Kiswahili they call it miko, that there are things we have to eat, There are things you don't eat for you to be safe. For endometriosis, are there conditions or lifestyles which, if someone adopt them, at least they lower the risk of being in that condition?
Well, first of all, the best way of reducing this is to reduce the number of menstruations. Okay. And that can only be done either surgically, which is a no-go because it would destroy the fertility of the patient,
yes.
but that can only be done by hormones, as I mentioned,
okay.
oral contraceptives, the pill, yeah? Or sometimes in women an IUD that's being inserted into the uterus,
yes.
which is reversible, which is very important.
Okay.
Yeah, not to destroy or impair the fertility of this young woman.
Yes.
But also what you mentioned about food.
Yes.
There are certain food attributes that would reduce the risk of developing or increasing the pain in endometriosis. And one is if you take less red meat. Yes. Chicken is fine, but red meat like beef and so on is not as good, okay. Because this increases the inflammation in the body. Yes. That also refers to histamine in food, which is in old cheese, it is in some fish, it is in vinegar, it is in red wine, and that will increase this. On the other hand, what can be done in order to sort of reduce the risk by using it, it is omega-3 fatty acids, which again is in fish.
Yes.
But you can also take it as a pill from the pharmacy.
Yes.
If you eat a lot of cereal, if you eat a lot of fruit, so other health attributed food materials is very good for doing so.
Thank you.
On top, it is very good to exercise.
Yes.
And I'm sorry to say, smoking also reduces the incidence of endometriosis.
Reduces?
Yeah, it reduces. So I'm against smoking because it is a health hazard.
Yes.
But what smoking does, it reduces the estrogen content in a woman.
Yes.
And therefore it reduces the acuteness of endometriosis. So this I don't like to tell, but in order to be concise, I have to mention it. But I hope I do not encourage anybody to start smoking.
Thank you so much, Professor. You know, actually, we understand actually this is a more of academic and medic, and you have to explain it. You know, you are speaking this when in this country people are held discussing the issue of especially weed, because when I look at viewers, I remind you that we are live on Facebook, Al-Huda Facebook, and also live Facebook of Dr. Hassan Kenyomari and also Hassan Mari. Someone here is asking a question. When you talk of the smoking you're talking about, is this the smoking of cigarette or smoking of weed, or whichever smoke?
No. It is smoking of cigarette,
okay,
because it is the nicotine content and all the other alkaloids that are in the tobacco smoke. Weeds, well, is cannabis a weed?
I believe so.
Yeah, okay.
Yes, cannabis sativa.
Cannabis will just reduce the pain, but will not act on sort of reducing the disease. It's only a very good painkiller.
Okay.
Yes, I think also I need to emphasize on what Prof has said. So Prof has talked about smoking. So it's not a must that, of course, when you look at, he has talked about alkaloids. Yeah, so those are some of the particles which are found in those cigarettes. So it doesn't mean that somebody smokes, but maybe we can have some particles which are made from alkaloids. Alkaloids, they're just substances which are found in plants. Yeah,
yes.
So maybe I can emphasize on that. Then also, apart from what he has talked, we have also some preventative measures, and one of the preventative measures is of course what we have been doing, like what we did last week. So we need to have increased awareness. Yeah.
Yes.
We need to have increased awareness campaigns, because if we have increased awareness campaigns about endometriosis, then people will know that there's this condition, and this condition in earlier stages. Yeah, if we had an early diagnostic marker, or if somebody starts feeling the pain, let's say the first period or the second period, that this condition can be reversed.
Okay.
At the early times. Yeah, so the problem we have is it takes a long time for the condition to be diagnosed, and by the time it is diagnosed, the cells have gone to where they are. They have grown, where the profs talked about. So it's not easy. So it needs surgical operation. Then now the other problem is you can do surgery, but there's increased chances of recurrence. Okay. Yeah, so you can do the surgery, then after some time it reoccurs. Yeah, so that's...
it might reoccur,
yeah,
not necessarily,
might, yeah.
but one has to be aware
Yeah.
of, and
Yeah.
one has to inform the patient.
Yeah, so the way Prof said, before surgery takes place, so the patient needs to be informed. So we have like a questionnaire where they are told it might reoccur, for example. Yeah, so I think that's what needs to be done. So what I'm trying to emphasize, we must have increased awareness, and that's what we are doing. People need to have the information. And I'm here to say that last week we had the second East African Endometriosis Conference, and the main reason is to create awareness. So we invited a number of gynecological doctors. We invited counselors, we invited endometriosis patients, we invited researchers, we invited media. Of course, you are represented. You are represented from here. So I think that's also the best way we can prevent or we can manage this condition.
Thank you. We have Dr. Geoffrey Wango from the University of Nairobi. He says, thank you so much for bringing this great gentleman. What he's trying to ask is, at which stage is it reversible? And how much is the medication?
Prof.
Basically, it is reversible, and therefore it must be treated at every stage.
Okay.
However, up to date, we do not have a definite cure.
Okay.
We need to know. That's why surgery, as you outlined, is so important. But it also means the first surgery has to be the best and the final one.
Okay.
Or as some people say, has to be the last one.
Yes.
Now, in order to reduce the risk of recurrence, the most common treatment is progestins, which is a hormone. Okay. Unfortunately, these hormones also do have side effects. So if a woman tolerates these hormones, she is well advised to have them and to take them, reducing her periods, so she should not have any periods until she either wants to become pregnant or if her menstruation is going down anyway because she is approaching menopause. And the dose is just the normal dose, Dianagis 2 milligrams. This is the doctor that you just mentioned.
Thank you so much. The last question before we come to your final remarks. Someone is asking, what is the percentage of people with this disease because they are hearing it for the first time?
Thank you very much, Dr. Mal. So the global preference of this condition is from 6 to 10%. So we don't have a definite percentage.
Okay.
Yeah, so it varies from 6 to 10%. So which means in every 10 women, one of them has this condition. That's globally. But now when we come to Kenya and to a large extent Africa, the preference is not known.
Okay.
Yeah, so it's not known. So what we are trying to do as researchers and also the other stakeholders, we are trying to get the data. We are planning to get the data. Then after getting the data, after knowing the preference, then our next thing is to approach the government, because you have to approach the government when you have the data. And we hope at the end of it, we need to come up with a policy. Yeah, because this disease is a very serious condition. They call it, it's a silent tormentor, tormenting our ladies, our aunts, our sisters. So we need to have a policy, which means at the end of the day, the government needs, once we have the policy, the government can allocate some funds in their budgetary allocation to manage this condition.
Thank you so much, gentlemen, for honoring the invitation to be here. And now we allow you each half a minute to say something to the viewers before we adjourn the show for today.
If I may start.
Yeah.
Thank you for this opportunity.
Most welcome.
And I sincerely do hope that the viewers will take this serious as it is much more common, and it will be your next door neighbor, maybe even your child that suffers from this disease. It has to be recognized as being a disease, and it is very important that the everyday person, the lay people, recognize it as being not normal.
Thank you so much.
Thank you very much. So my last comment is as follows. So the first one is, if periods are painful, kindly don't normalize them. Yeah, so painful periods might be a sign of endometriosis. That's number one. Then number two, we need to have across, we call it a cross-disciplinary approach, or a multidisciplinary approach in management of endometriosis. So clinicians, researchers, patients, counselors, and all the other stakeholders must come together to cascade and to preach the message of endometriosis. Thank you very much.
Thank you so much, Professor Hans Tinneberg, and also Dr. Ezekiel Mecha, for this wonderful awareness to our people. Viewers, please take what you have heard very seriously and also pass it to other people, because you can save life. From us, from NASAHA UMMA, we thank you for watching, and we remind you that NASAHA UMMA comes to you every Monday to Thursday from 12 noon to 1 p.m. May God bless you, but continue watching Al Huda, because there is a lot coming on your side. Thank you, and God bless you.
Huruma Islamic Center Kiamaiko, Nairobi ilianzishwa mnamo mwaka wa 2016. Kwa sasa ina zaidi ya wanafunzi 200 kutokea chekechea hadi darasa la 3. Elimu inatolewa kwa wanafunzi, watu wazima na wale wasiojiweza. Changamoto